Every year on May 17th, the world comes together to observe World Hypertension Day, a crucial event dedicated to raising awareness about high blood pressure. This day shines a spotlight on a condition that quietly affects over 1 billion people across the globe, often without them even knowing it. Despite its prevalence, hypertension remains underdiagnosed and undertreated, making it a major public health concern that transcends borders, cultures, and age groups. Hypertension is often called the silent killer for a reason. Most people experience no obvious symptoms, yet the damage it causes can be severe and irreversible. Left unchecked, high blood pressure can lead to heart attacks, strokes, kidney failure, and other life-threatening complications. It quietly undermines health, making early detection and management absolutely vital. World Hypertension Day is a powerful reminder for everyone to know their blood pressure numbers and to understand the risks associated with elevated levels. Checking your blood pressure is quick, simple, and can be life-saving. It empowers individuals to take charge of their health and make informed decisions. Across the world, health organizations, medical professionals, and local communities unite on this day to share vital information, organize free screenings, and promote healthy lifestyle habits. These collective efforts help break down barriers to healthcare and ensure that everyone, regardless of where they live, has access to the knowledge and resources they need. The aim is simple yet profound: to prevent complications and save lives through greater awareness and proactive action. By encouraging regular blood pressure checks and healthier choices, we can reduce the burden of hypertension on families and communities everywhere. World Hypertension Day also serves as a bridge between complex medical knowledge and everyday understanding. Through educational campaigns, workshops, and accessible resources, it makes important information clear and actionable for people of all backgrounds and ages. Whether through local health fairs, school programs, or global campaigns, the message remains the same. Take control of your health and encourage those around you to do the same. Every action, big or small, contributes to a healthier world. High blood pressure is both preventable and treatable, but only if we act early and consistently. Simple steps like regular exercise, a balanced diet, reducing salt intake, and routine checkups can make a significant difference. From small rural villages to bustling city streets, the call to action is universal. Check your blood pressure, adopt healthier habits, and inspire others to do the same. No matter where you live, you have the power to protect your heart and your future. This day is about more than just raising awareness. It's about inspiring real, lasting change in how we approach our health and support one another. By embracing this global effort, we can build a healthier future for ourselves and for generations to come, one blood pressure check at a time. Together, united in action and awareness, we can turn the tide against this silent threat and create a world where everyone has the chance to live a longer, healthier life. Hypertension is often called the silent killer, and for good reason. Most people with high blood pressure feel completely normal, with no warning signs or symptoms to alert them. But beneath the surface, this condition quietly damages your arteries, heart, and vital organs, often for years before you notice anything is wrong. Many people live for years unaware of the danger lurking inside their bodies, which is why regular checkups are so important. Think of your blood vessels like a garden hose. If the pressure inside is always high, the hose starts to swell, strain, and eventually it can burst or spring leaks. Over time, this constant strain causes your arteries to harden and narrow, making it harder for blood to flow. This can lead to serious health problems like heart failure, heart attacks, strokes, kidney disease, and even vision loss. The only reliable way to know if you have high blood pressure is to measure it regularly, even if you feel perfectly healthy. Checking your blood pressure is quick, painless, and can be done at a doctor's office, pharmacy, or even at home with a simple device. Don't wait for symptoms to appear. By the time you notice something is wrong, the damage may already be serious or even irreversible. Learning about the risks of hypertension is the first step toward protecting yourself and your loved ones. By making healthy lifestyle changes like eating nutritious foods, staying active, managing stress, and taking medication if prescribed, you can control your blood pressure and reduce your risk of serious complications. Take charge of your health today. Don't let this silent danger go unnoticed or untreated. Your future health, happiness, and quality of life depend on the choices you make now. Start today for a healthier tomorrow. World Hypertension Day began in 2005, marking a pivotal moment in the global fight against high blood pressure. Before this, hypertension was often called the silent killer, quietly affecting millions without obvious symptoms. Many people lived their lives unaware of the risks building up inside their bodies. The day was sparked by a growing global need to address the hidden crisis of undiagnosed high blood pressure, which was silently contributing to heart attacks, strokes, and kidney disease worldwide. Health experts realized that without urgent action, the problem would only get worse. The World Hypertension League, representing 85 national societies from every continent, launched the day to focus attention on prevention and control. Their vision was to unite doctors, nurses, and communities in a shared mission to save lives. In 2006, the date was officially moved to May 17th, transforming World Hypertension Day into an annual call to action. Every year, people around the world are encouraged to check their blood pressure and learn about the dangers of hypertension. At the time, less than half of those with hypertension even knew they had it, and many weren't receiving any treatment at all. This lack of awareness meant that millions were at risk without realizing it. The founders saw this as a communication failure, not just a medical one. They believed that information and education could be as powerful as medicine in preventing disease. Their goal was clear: empower people everywhere to ask questions, seek regular screening, and understand their own health risks. By encouraging healthy habits and regular checkups, they hope to inspire individuals to take charge of their heart health and make positive changes in their daily lives. The campaign quickly grew from a single day of awareness to a month-long movement in many countries, with events, screenings, and educational programs reaching millions. Local adaptation and grassroots involvement made it a global success, as communities found creative ways to spread the message and involve people of all ages. Doctors, nurses, and volunteers joined forces, organizing free blood pressure screenings, distributing educational pamphlets, and holding workshops to teach people how to manage their health. Today, World Hypertension Day is a worldwide effort, saving lives through knowledge and action. It stands as a reminder that with awareness, education, and community support, we can all play a part in preventing hypertension and building a healthier future. World Hypertension Day's mission is to save lives through education and early detection. It teaches people that high blood pressure can lead to heart attacks, strokes, and kidney disease, often without warning. Campaigns use media and community events to spread this vital message, making the risks real and personal. The focus is on empowerment. Simple lifestyle changes like eating less salt, staying active, and avoiding tobacco can make a huge difference. Free screenings in public places make it easy for everyone to know their numbers. Early detection allows for timely intervention, preventing irreversible damage. The day also breaks the stigma, encouraging open conversations and support for those diagnosed. By normalizing blood pressure checks, it helps millions manage their health confidently. Awareness leads to action, and action saves lives. Each year, World Hypertension Day adopts a theme to focus global efforts and unify the message. A recent theme, Measure Your Blood Pressure Accurately, Control It, Live Longer, breaks the fight into clear steps. Accurate measurement prevents misdiagnosis. Controlling blood pressure means following treatment and healthy habits. The ultimate reward? A longer, healthier life. This simple positive message inspires participation and commitment worldwide. By focusing on practical steps, the campaign motivates real change. The theme's clarity helps everyone, from patients to policymakers, work toward better heart health. World Hypertension Day sparks change beyond awareness. It drives improvements in healthcare and policy. Hospitals and clinics use the day to review and upgrade screening and treatment protocols. Health organizations leverage the momentum to push for stronger public health policies like better food labeling and more public spaces for exercise. The day encourages investment in research, affordable medications, and expanded healthcare access, especially in underserved areas. It also strengthens global partnerships, allowing countries to share successful strategies. These collaborations accelerate progress and standardize care worldwide. By putting hypertension on the political agenda, the day ensures lasting systemic change. The result, healthier communities and a stronger global response to this silent threat. In low and middle-income countries, World Hypertension Day is a lifeline. Many people lack awareness and access to screening, leaving millions undiagnosed and untreated. On this day, mobile health camps and free screenings reach remote villages and busy markets, often providing the first-ever blood pressure check for many. Educational materials in local languages and community health worker training ensure the message lasts beyond a single day. International attention brings vital resources, medicines, equipment and funding to where they're needed most. The day's impact is both immediate and long-term, building sustainable health infrastructure. World Hypertension Day is more than awareness, it's a catalyst for lasting change in the world's most vulnerable communities. The future of hypertension control is being shaped by technology, youth engagement, and global strategy. Wearable devices and health apps now help people monitor blood pressure and stick to healthy routines. Reaching young people in schools is key. Healthy habits formed early can prevent hypertension later in life. Countries are adopting national plans, reducing salt in foods, and integrating blood pressure checks into routine care. Community-based programs empower local leaders and health workers to drive change from within. Partnerships with businesses and organizations foster a culture of wellness. By combining technology, education, and policy, we can make real progress. The next generation will be better equipped to prevent and control hypertension worldwide. World Hypertension Day is a global movement, not just a date. It empowers people to protect themselves and their families through knowledge and action. The day's ripple effect drives prevention, early detection, and stronger health systems. As technology and education evolve, so does our fight against hypertension. Every action counts, from checking your blood pressure to supporting a friend. Together, we can reduce the toll of heart disease and stroke. The message is clear: hope, empowerment, and collective action can overcome this silent killer. Let's carry this spirit forward, building a healthier world for generations to come.